There is not a miracle medication that's going to make you lose weight without you putting the effort. Let's talk about GLP-1 receptor agonists because everybody knows about these medications and they're using it like it doesn't have any side effects. So let's keep in mind that semaglutide, which is Ozempic and Wegovy, both of those brand names have the same ingredient, which is the semaglutide, correct? Now that we clear that up, semaglutide is a medication that was originally approved for type 2 diabetes, but later got the FDA approval for medical assisted weight loss as Wegovy. The problem that I'm seeing is that people are so desperate to get their hands into this type of medication for a cheap price that they're buying this medication from overseas and injecting themselves in their houses. And the problem is that if you do these medications without medical guidance, there is always a risk of severe complications such as gastroparesis or even intestinal obstructions. There is one case reported of a woman that died sadly because she was trying to slim down for her daughter's wedding. She didn't even make it to her daughter's wedding because she injected 2 different GLP-1 medications without her doctor knowing because she wanted to be skinny for her daughter's wedding. So people, even though these medications are available online, buying it from God knows where, that doesn't mean it is safe. And that doesn't mean those medications are coming from an FDA approved pharmacy or those compounding pharmacies that are legally allowed to compound this type of medications. So you gotta be extremely careful. Where do you get your medication from? Because if it's not from a reliable sources, you have no idea what you're putting into your body, and that could be extremely, extremely dangerous. Yes, I understand these medications are expensive, but you're playing with your health at the end of the day if you don't do things properly. If you go to the pharmacy without insurance and you want Ozempic, which is brand name, or you want Wegovy, which is brand name, be expected to pay anywhere from $950 to $1,250 a month for that medication, because that's how much this medication costs in the United States of America. Now, semaglutide, because it is compounded, is slightly more affordable when done properly. Once again, same story with tirzepatide, which is Mounjaro, and Zepbound. Zepbound is FDA approved for medical assisted weight loss as of November of 2023. Mounjaro has been in the market a little bit longer for type 2 diabetes. But what I want to say is that, yes, this medication work, but they're not a miracle. They're not, period. So if you're not going to do your part, if you're not going to change your lifestyle, if in your head you're going to lose 40 pounds in a month, then this medication is not for you, and I'm not going to accept you as a patient in my practice, because we have to be realistic and we have to set realistic goals. It is not normal for your body to lose 40 pounds in a month. It is just not healthy, and that could be dangerous in the long run. Now, I want to talk to you about research, and I actually pulled out the research that were done on this type of medications because I want to let you know exactly how much percentage of weight you can lose on this type of medications, again, when done properly. So let's talk about Wegovy, which is Ozempic, which is semaglutide, correct? So subjects lost about 14% of their body weight after 68 weeks. So if we know a year has how many weeks? I think it's 53. So 68 weeks, meaning about a year and 2 or 3 months, they were able to lose 14% of their body weight. So if I weigh 200 pounds and I'm down 14% of my body weight, that means that I lost 25 pounds. So subjects on this medication after a year and 2 months lost 25 pounds. Research. So if you don't lose 20 pounds in a month, please keep in mind that that is not realistic. Let's continue. Same medication, Wegovy. The same subjects were followed for another year, and after 2 years, they lost about 17.4% of their body weight. So if I weighed 200 pounds and I lost 17.4% of the body weight, I'm down 34.8 pounds after 2 years. Again, this is obtained from the actual research, and you can find this as simple as going to the National Institute of Health, and you can type down Wegovy research trial, and all this is going to pop up for you to review. So, dear patients, if you don't see that scale moving as fast as you would like, there is always a reason. This medication is just a tool on our toolbox to get you better. My goal is not just for you to lose weight. My goal is to optimize your metabolic health, because there's no point of you doing these medications if you're not changing your lifestyle, if you're still eating food that are highly inflammatory and food that make your insulin go up. If your insulin comes up, you're going to be on a fat storing mode. If your insulin comes down, you're going to be on a fat burning mode. So you want to make sure that your insulin is normal and you're not having peaks of insulin, because otherwise you won't be able to lose weight. I think that's important for us to understand, because I am seeing a lot of unrealistic expectations, not just in social media, but everywhere. These medications are not going to magically make you lose 20 pounds in a month. That is completely impossible. Okay? Me, myself, and I lost 51 pounds, but it took me a year on tirzepatide. So I'm telling you, I did it, and I did it properly because I follow the recommendation guide and the dose that was studied in research, and that is FDA approved. So I'm not gonna give you a higher dose of what was studied, because there's always a risk of severe side effect, again, like intestinal obstruction or gastroparesis, and you name it. And unfortunately, this medication has this bad name, right, of saying, oh, it can give you the severe side effect, your stomach is not going to move, your intestines are not going to move, you can have severe constipation, and that is completely correct when it's not done properly. If you follow the instruction, if you slowly increase your dose, you avoid the majority of those side effects. But that is the importance of following with your medical provider, the person that prescribed this medication. Please keep in mind that whomever is giving you this medication has to be a medical professional with a medical license in Florida. Let's talk about tirzepatide. In the research of Zepbound, subjects lost 22.5% of their body weight after 72 weeks. 72 weeks is 1 year and 4 months. If I weigh 200 pounds and I am down 22.5% of my body weight, that means that I lost 45 pounds after a year and 4 months. That is realistic. So you're not going to lose 20, 30, 40 pounds in a month. You're not going to lose 40 pounds in 3 months either, especially if there is a hormonal imbalance, polycystic ovary disease, if you're going through perimenopause, or if you are postmenopausal. Those problems need to be addressed in conjunction with GLP-1s, otherwise you won't be able to be successful in the long run, and that's going to create more problems for your health. I hope this helped. And my mission is to kind of help you understand how these medications can improve your metabolic health when done properly.